Coming up next on Another View, what does it take to make a city healthy? There's a new initiative in Norfolk. It's called Healthy Norfolk, and its purpose is to raise the quality of life by supporting safe, healthy, and active living. The city of Portsmouth is already working on its own healthy status, but why would a city take this on? How can city government make a difference in your personal health? What does it really mean for citizens? And is this the beginning of a trend for all Hampton Road cities? Our guests, Norfolk Councilwoman Dr. Terri Whibley, Dr. Dominique Williams, and Ms. Amy Paulson have some answers, and we'll take your calls right after this news from NPR.
Discussing the issues and celebrating the successes of the African American community. This is Another View.
Don't you just love our enthusiastic audience every week? It's just great. Hi, good afternoon, everyone. I'm Barbara Ham-Lee. Welcome to Another View, and my special thanks to Lisa Godley for handling things last week while I took a little mini vacation, but I'm glad to be back with you this beautiful sunny afternoon. It's called Healthy Norfolk. It's a new city initiative spearheaded by Norfolk City Manager Marcus Jones and designed to improve health and wellness throughout Norfolk. Now, there's already underway the Healthy Portsmouth initiative. So the question is, why are city leaders getting involved in the personal health of its citizens? Our guest has some answers. Please welcome Norfolk Councilwoman Dr. Terri Whibley. Terri, welcome.
Thank you.
Thanks so much for being here.
Thank you for promoting this.
Dr. Dominique Williams with CHKD. How are you?
I'm doing well. Thank you for having me.
Good to have you. And Amy Paulson, Director of the Consortium for Infant and Child Health, or CINCH. Hi, Amy. How are you?
Thanks for having me.
Glad to have you ladies on. So why is Norfolk, and I'll start with you, Dr. Whibley, why is Norfolk involved in a healthy initiative? What's this all about?
Well, I personally believe that I think our role is to take care of our citizens. And even if you didn't care about the physical health of our citizens, which I think we all do, we also understand the economic impact of a healthy city, the environmental impact, which of course impacts both economics and health. Mm-hmm. To me, it's a no-brainer.
So the city, Marcus pulled together a bunch of people, different organizations and so forth. Amy, you're involved. From a perspective of outside companies that aren't necessarily attached to the city of Norfolk, what's the benefit?
Well, there are a lot of economic benefits, obviously, to having healthy employees. There's also, I think, just some civic goodwill that's involved as well. But when you do an initiative like this, it's not about one entity coming forward and planning a project. Mm-hmm. It's really about a lot of partners coming together to change how we live our lives, to create environments that allow us to be healthy, to make the healthy choice be the easy choice. If it's healthier to do something, we all know we don't necessarily do those things. Yes. But if it's easier to do those things, that's when we engage in those behaviors. Mm-hmm. So if it's easier to take public transit, take the Tide somewhere in Norfolk, or to walk somewhere in Portsmouth because now there are great new sidewalks and crosswalks, then we might be more likely to do those things. And it's really about constructing environments. And so you need all those partners to make it healthy where we live, learn, play, work, and worship.
Mm-hmm. So Dominique, I know children, that's your specialty. Yes. And we worry about our next generation. And we know that obesity is such a huge issue. So an initiative like this does what in terms of the message you've been trying to get out?
I think it shows young people that it's not so much as I say, not as I do, but now you can do as I do because, like Amy was saying, the environment is set up so that it's easier to make a healthy choice. And the fact of the matter is that if we don't address the younger generation when they do become older, if they're sicker, then they are less productive, then there is less of an economic contribution to the city, that they're less able to continue to make Norfolk a great and productive place. So from a pediatric perspective, this is an investment in the future, but it's also addressing where those kids are at right now to make them healthy and productive in school, and have self-awareness and understand that
it's easy to make a healthy choice if everything around you is set up to make it that way.
440-2665 or 1-800-940-2240 are the numbers to call to join our conversation today. We're talking about living healthy. We're talking about environment. We're talking about ways that we can make some changes and things that the city can do to help make it easier for us. And whether you're a Norfolk citizen or a citizen of any of the areas within Hampton Roads, there are things that you can do individually and as a community to make life a better place. So give us a call. Let's talk about it. 440-2665 or 1-800-940-2240. So Terri, how does this come together? How do you bring the people together to start this change? Where do you begin?
Well, I think awareness is probably our biggest hurdle, to encounter. We've set up some steering committees, starting to plan. You also need to know where you are now so you have benchmarks to determine how you're doing. I mean, one of my pet peeves is to push out a program and then never be able to know whether or not it was effective. So all those things, of course, are crucial in getting this started.
So right now we're in the process of actually doing some benchmarking in various areas. Can you talk about some of the areas?
Drawing the partners together. And, as Amy said, we've got so many partners in this area. When you talk about the educational community, our medical community, civic leagues, this is when I go out to talk to citizens in the city, this is a really popular program. I mean, people are energized by it. We all talk about budget constraints. We all know that our cities and our states are strapped financially. This isn't a big budget issue. This is really a matter of getting folks together and making them aware of how they as individuals can make a difference globally. What is that? Think locally, act globally, whatever that is. You know what I mean?
Yes.
So, I think it's a really exciting way for the city to start, and we're lucky that we have an administration that was very receptive to this. As soon as our manager Marcus Jones started, I cornered him on this and said, "Let's get going." And he's certainly interested in health for himself and his family.
Yes, I've seen Marcus jogging along.
You betcha. Yep. I challenged him to do the
Hampton
first Norfolk half marathon, and unfortunately, he took me up on it, so I had to do it too. But anyway, so I think we've got some good energy starting.
And in full disclosure to my audience, I am on the steering committee. Also was asked to represent from WHRO, and it was amazing to me how many different entities were able to come together and all have a common goal, which was really nice. Amy, you were involved in Healthy Portsmouth,
yes,
which has gotten kind of a jump on Norfolk in terms of putting things in place. Can you talk to us a little bit about that process and what changes they've been able to make so far?
Sure. Portsmouth was a key partner in us applying for a national grant. It's called an ACHIEVE grant. It's Action Communities for Health Innovation and Environmental Change. It's part of the CDC's Healthy Communities program. And our specific grant came through the National Association of Chronic Disease Directors. And one of the reasons that we chose Portsmouth was we already had active partners there that were starting to coalesce around this issue. And we made the application. Portsmouth had a lot of health challenges, made us a good choice for it, and we had also had the partners in place. What we did first is, as Terri talked about, was we did an assessment of the city's health, and it's really critical to figure out where you are when you start. And then we worked with the citizens and worked with other stakeholders in Portsmouth to develop a comprehensive community action plan that we're working on currently. The action plan focuses on a couple different areas. It focuses on increasing walkability, which was one of the primary issues we were concerned about in Portsmouth, in enhancing school health and wellness, in increasing breastfeeding support, decreasing tobacco smoke exposure, because in the case of ACHIEVE, we also cover other issues besides just physical activity and nutrition. That initiative looks at chronic disease. So the big three factors for that are physical activity, nutrition, and tobacco smoke exposure. And then our last goal is in is inspiring healthy activities. And so we're looking at things like community gardens, sterile promotion programs, those types of activities in the city.
And after you did your study, there were actually some physical things that the city did, like you were talking about expanding the sidewalks, for example.
The city actually has a fantastic policy related to what we call complete streets that was already underway when this project started. So we were able to partner with them to help support the implementation of their master transportation plan. Complete streets basically means that the streets are not just for cars. When a street is complete, it makes way for cars, it makes way for people on foot, pedestrians, it makes way for bicyclists. So the street is complete when it has access for everybody. And so in Portsmouth, we are working with them to not only make sure that ongoing projects include complete streets. So if you look at some of the renovation areas, because you can't afford just to go out and change everything. So as projects take place, they're making wonderful change. Have a great transportation director, Susan Wilson, who's been working hard to make it happen. But then we also were able to obtain external grant funding from the Virginia Foundation for Healthy Youth to do a special project in Port Norfolk as a demonstration project. We worked with that community. We held several meetings. They identified what the issues were for walking. Some of them were physical. Some of them were policing concerns, safety concerns.
So safety is a part of this also.
And we worked with them for several months. The community themselves identified a 1.5-mile route. And we worked with them in the city and used the funding from our fantastic partners at the Virginia Foundation for Healthy Youth to do sidewalk enhancements where they needed to be made, to put in crosswalks. The city has planned renovations down the Mount Vernon corridor that are going to be underway as well as part of this project. And the idea is to make it walkable. And Port Norfolk has great walkable areas. There are places to walk in Port Norfolk. So the idea when you do an urban walking trail like this is that it's destination oriented. You don't just walk to walk, although certainly we encourage people to do that, but you walk to get places. And if it's easier to get to that place by walking instead of driving, you will.
So you're talking about learning, utilizing a way so that people can incorporate walking into their everyday activities. Exactly. So it's not a separate, let's go for a walk, but it is making the store accessible, for example, close by.
Or the
rec center
or
wherever.
Or the corner store. There's lots that they can walk to. And we just had a big launch event for that project, although we're still waiting for the Mount Vernon corridor to be finished, and that'll have bike lanes. And they're doing traffic calming measures, reducing to 2 lanes to slow the traffic down, putting in crosswalks and ramps and stuff like that. We had a big launch the other weekend for Portsmouth Walks, which is what the program's called, and had a enormous hundreds of people came out for it. Just kids on bikes, people on foot everywhere. It's fantastic.
Wow. Dominique, it sounds like this is a mindset change in terms of the way that that the cities approach new projects, approach what they're currently doing. Talk a little bit about that for us.
Well, I think it goes back to what Amy was saying, is that just because you have a street, shouldn't be solely focused on the car, that the mindset is there's other forms of transportation, and to encourage that means that you have to make those roads and modes easier to do. So to have a complete street in your community, it also means too that a child is more likely to walk to school, and that it would be safer, that a child could bike to school and go back and forth in different parts of the community without fear of not being safe or not being accounted for on the road, that there won't be a proper place for them. So the mindset changes to emphasize every part of the community and how this road, this building affects them, not just how can I get people to go into this business, how can I make a roadway to get to this business. It's how will this support my community in every way. And I think that that's where it requires new programs to account for that, existing programs when they change to consider it, and to keep having an ever-present program like Healthy Portsmouth, Healthy Norfolk, to say, keep in mind that as you put this in the community, it's more than the fiscal health, it's the physical health that we need to consider as well.
But Terri, how do we change the mindset, though, of the citizens? Because you could have all these nice walkways and all of that, but if people don't buy into this idea.
Right. Well, we're starting today,
okay.
And this is a good start. But yeah, that's exactly what it's going to take. And It's going to be outreach in the steering committee, and we've already started with some events. I hope all of you know this is Bike Month, and so we're going to start on this Saturday with our first Bike Fest, and there'll be a bike ride up the Elizabeth River Trail, which has been one of our success stories for the walking trail. And then we'll have a community bike ride in different areas of the city every Saturday of May. Okay. And I hope many of you read that we've started a biking commission. Our first meeting was last night, and those are great advocates for our city. And so I think we take small steps, but by using our partnerships that we've developed, we're going to get the word out.
I have to tell you, too, my husband just bought a bike, and so he's going to be really excited to hear about where to ride in Norfolk, because that's I think another part of it is, okay, I have this desire. I want to get more healthy. I don't know where to go. I don't know what to do. So
and
tell us a little bit about like the ride on Saturday. Where would people?
Well, we'll start at Town Point Park, and the ride itself starts at 2:30. But at 2:00, I think, is the kind of the warm up and the safety talk. But all day long will be activities related to the Bike Fest, including licensing and activities for bikers. And online, we've started working on networks to show some bike-friendly routes. But one of the roles of this commission will be to develop those kinds of routes, the things that Amy's talking about, making our streets calming the streets and allowing sharrows and also bike lanes, buffered lanes. We've already even started one lane that's on a one-way street that the bike lane goes the opposite direction. I know that sounds counterintuitive, but it actually is a way to make for a safer and a little more buffered lane for bikers.
I remember reading in the New York Times a couple months ago, the head of transportation catching a lot of heat because she really wanted to carve up the streets to allow bike lanes in New York City, and that people are like, with all this traffic, and now you want bike lanes too. But
New York City in 2006 decided they would have 200 miles of bike-friendly streets and lanes for their city in 3 years, and they achieved it. And we can set goals like that. It's just a matter of making that commitment to doing it and getting the community engaged.
So we talk about some kind of long range plans and so forth, but let's bring it down to what's happening right now. What people need to know is available here in Norfolk right now to help to live a healthier lifestyle. Amy, I'm going to turn to you to start that conversation. What are some of the things we're already doing?
Well, certainly with the Healthy Norfolk Initiative, which I'm also involved in, and actually worked with WHRO and our partner Kelly Jackson, who was very involved in Portsmouth, to initially talk with the city about moving forward on this. So we're real excited that it's come to fruition. But we definitely have the Walk a Day in May program that's coming. We're asking community groups to all plan their own walks in May. But ongoing in Norfolk, we have things like the Business Case for Breastfeeding Project, which is a project that CINCH and EVMS, our lead agency, have worked on over this last year or so. And it was an initiative that we did in Portsmouth, but we also included other cities in that initiative.
And this means to allow or for businesses to become more friendly, if you will, and provide places for women to breastfeed, or explain a little bit more about how that works.
Sure. The Business Case for Breastfeeding is really working with businesses to help them understand that supporting mothers who are returning back to work after the birth of a child in being able to continue to provide breast milk for that child benefits them as an employer, it benefits the employee, it benefits the baby. It's a win-win-win-win-win. Babies are healthier, mothers miss less time of work, there's less turnover, the employer has better productivity. And it's not about only providing the space, which is important, and it must be a space that's not a restroom, because you wouldn't eat your lunch in the restroom sitting on the toilet in your clothes. We wouldn't expect a mother who was formula feeding a baby to go into the restroom to mix the formula bottle. Yeah. It's a normal activity. Our social norms, we have some issues with that. But it's also about passing policy within those businesses to be able to provide that mother with flexible break time and to outline the provisions that they're willing to make so that the mother legally has rights within that organization. It was also part of the National Healthcare Reform Act as well, that businesses make provisions for this under the Fair Labor Standards Act.
Did you find any pushback?
For the businesses that we worked with, no. Not to say that it's an easy thing to do always, because there are lots of challenges in different types of organizations with different types of employees, and certainly employees that for instance, somebody who works in a convenience store, it's a much more difficult proposition than somebody who works in an office building and doesn't have to be available for patients or those types of things. But it's feasible everywhere, and it benefits us. It benefits our babies. We know that, breastfeeding does so much in terms of health that formula doesn't. And again, it's about policy change, and those are things that are happening here in Norfolk. EVMS, actually, our own institution, was one of the organizations that we worked with as part of the grant that we had last year from the Virginia Department of Health Champions Program. And what they found is that one room wasn't enough. And, some people were very surprised, like, where have all these women been? And we said, well, they've been in the bathrooms and in their cars or in their own offices. But by providing those opportunities, we had one person who told me, you've made it possible for me to continue to do this. And great partners in human resources and occupational health, but that's happened across the region, and we're hoping to, we're waiting right now to hear about additional funding to continue that outreach, but also working with organizations to implement stairwell promotion programs and weight loss programs at work, neighborhood programs. Those are all things that we want to see happen in the community.
Dominique, I look at Portsmouth and Norfolk, and since this is another view, we know that that both of these cities have very large African American populations, and as Lisa and I are famous to say, when a disease or an issue, health issue, hits the African American community, it seems to be so much more prevalent than other communities, particularly smoking, health heart disease, breast cancer, things of that nature. So how will this help to change some of the healthy habits or the unhealthy habits within the community?
I think changing the built environment or the neighborhoods that would make it easier to get to the park, to walk to the park, make it easier to walk to school, that if you look at it, how it would affect one population or another, the other part of it is, yes, it's the African American community. Where would most of the African American community reside in the city of Norfolk, or is there something special about where African Americans live in Norfolk that their neighborhoods require equal attention or special attention about making a complete street? If there's a business case for breastfeeding, how does that support that young mother who wouldn't otherwise have the support? And it's a pay it forward kind of mentality, especially with the breastfeeding, is if you support them at that point, that helps with acknowledging hunger and satisfaction cues in that baby, that then helps with feeding practices that would facilitate health in that baby, so that now you have a healthier baby, you have a happier mom, you have a more productive mom who's going to work.
So there's a continuum there that just...
Right. And so it's like Amy was saying earlier, it's not individual health, it's population health, but it's also, you have to pay it forward. And if there's disparities in the number of African American mothers who continue to breastfeed beyond 6 months, if there's a business case for it and now the environment to facilitate it, how many more would continue to breastfeed? How much healthier could their babies be? How much better job do we do of closing that disparity in health, so that it's less of us having to consider it, because now we truly have a healthy population, not healthy pockets of the population.
I want to ask both of you, because both of you have made the statement now that it's not necessarily individual health, but it's a population health. Explain what the difference is, Amy.
What we're really looking at is not, lots of people go, well, why are you worried about my own health? And I think, people should be worried about their own health. And if they're worried about healthcare reform at all, they should need to know reform starts with them. But we're really talking about population health. We're talking about health across communities, because that's how, from a public health standpoint, we look at that data. And that's how we know what's going wrong in communities around health. And so what we're looking at is not about it maybe intervening with you individually or Dominique or Terry. We're looking at intervening with populations. And so, it's not about creating a walking program here or there, although certainly that can be part of this type of initiative to spark interest. But it's also about creating, again, those policies, those environments, and those systems that support them being able to engage in those activities, and fundamentally shifting our social norms. So when it becomes more normal for a woman to breastfeed her child than it does to formula feed a child, then we know that we've won this war.
Gotcha.
Yeah.
Gotcha. Terry, one of the big issues, I know because we did a show on this when the show was on TV, and that's food deserts. That's places within our city where fast food places and convenience stores are much more prevalent than large grocery stores where you can get more fresh fruits and vegetables and so forth. There was some talk about some changes along that line. Can you?
Yeah, as you're saying, even though in many ways we talk about individuals, but this idea of taking care of a city, of a population, of a region, really comes down to some public policy. And development is one of those. And just as you said, too few of our residents have easy access to healthy food. And healthy food, I think we all were aware of Michelle Obama's awareness of the fact that sadly, often healthy food is more expensive. Mm-hmm. And when families are striving to meet their budget and they are trying to make choices, too often the dollar is more important than the health content. And I believe Mrs. Obama has been working with food manufacturers, for instance, to keep those prices down on healthy alternatives for food. But when we look at development in those areas and look at yet another convenience store coming into a deprived area, I think that's where we as a city need to make a hard look and say, maybe not. Another place is our recreation centers. Sadly, we've had to close our recreation centers for a day or two a week because of cost constraints. And I'm pleased that we have turned that around this year and listened to the community, and those recreation centers will now be open more often during the week. And so it's small steps like that are big steps.
That are big steps. Mm-hmm. If you're just joining us, we're talking about the Healthy Norfolk Initiative with Norfolk City Councilwoman Dr. Terri Whibley, Dr. Dominique Williams with CHKD, and Ms. Amy Paulson, Director of the Consortium for Infant and Child Health, or CINCH. Give us a call, 440-2665 or 1-800-940-2240. What is happening in your neighborhood? What are some things that you see that may, with slight change, may help to make a healthier, safer neighborhood? We're going to talk to Danyata from Norfolk. Hi, Danyata, you're on the air.
Hi, how are you?
Okay, how are you?
I'm well.
Good.
I am calling, I guess my question is directed to all the panels, mostly Dr. Dominique Williams, because she'll be speaking at our breakfast on May 23rd. But what I have found with the Virginia Kids Eat Free program, we've been able to serve over 1 million free meals to kids since 2006. A lot of the kids that we reach do not get the type of nutritional meals that they need. And so our program has been a conduit for them. Some of the things that we have found is that the kids are eating and that they may be obese, but it's because of the portion sizes, and people want to say because you're fat, I hate to say the word, that you should stop eating. And so they don't know that it's a process. So I just wanted to know if Dr. Williams was going to be a part of the panel that's being put together with the city manager, Jones, to enforce that it's just not about stopping the kids from eating, but about teaching them portion and serving sizes and just continuing to make a way for them to be able to get the healthy meals, because healthy meals are much more, they're more expensive, and I know some of the school systems are going to vended meals, which aren't nutritional at all when you look at the sodium content that is in them.
Okay, go ahead.
I think you raised excellent points. And to your first question, yes, I'm working with Mr. Jones in the city of Norfolk, and I am part of the steering committee to provide, the multidisciplinary representation, because it's not just the health community saying on behalf of children, make things a little bit better. I think the issue of childhood obesity, the issue of food deserts, the issue of healthy food choices, it's so complex that it requires a systems approach to resolve it. Part of what characterizes a food desert is the inability of a person to physically get to a store, even if it had whole food. whole food. So even if a community doesn't have it, how difficult would it be for that person to get to a place that has whole food? So that's the first thing. And so again, changing the environment to make it easier to get there, that's a way to address it. The second thing is that knowledge doesn't equal action, because there's so many obstacles to taking what you know and turning it into action. And so some of these families that are on hard times and don't have enough money, they know what they need to buy. It's just, it is difficult. It is expensive to buy it. And that's part of our responsibility as public health providers, as members of the community, as physicians, whatever it may be. But there are food markets, there are farmers markets, there are places in the community, especially for families that have the Supplemental Nutrition Assistance Program, that you could get 2 for 1 for whole food. So if it's $1 to get something healthy, if you have the SNAP benefit, now you get twice as much for that $1. But that's part of us raising the awareness of that's how you find it. And so it's a very complex issue that requires us to come at it at different ways. Portions is just part of it, but it's addressing the environmental obstacles to allowing the families that are well-intentioned and trying to turn that into a healthful action.
Okay, Danyata with Virginia Kids Eat Free, thanks for your call. Amy, you wanted to respond to that too.
Yeah, I think one of the things we can't lose sight of here, we often think about it's what you eat. It's people will go, well, they can start playing the blame game. Oh, yeah. It's they could choose.
Yes.
I don't care if they're poor, or they live here, they live there. They could choose to do X, Y, Z, and we always try to remind people that, when you live in a disparate community, when you're poor, when you're in an at-risk population, it's no longer about the blame game. It's about, does the environment support the behavior, and transportation is a key piece of that. So we know that there's a big difference between what's offered at the corner store than what's offered at the full-service grocery store. But let's say you're a single mom. Let's say you have 3 young kids. Let's say you work full-time. Does your bus route even run that late at night so that when you get home from work and pick your kids up from childcare, that you can get to a full-service grocery store? Assuming that it does. People go, well, they could still buy healthy things. Well, you're a single mom. You're on public transit to get where you need to go. Let's say you don't have a car. You're wrangling 3 small children. One of who's probably in a stroller, another one who you got to hold on to. So you go to the store. So let's say it's during the summer. So you're not going to buy fresh fruits and vegetables because they're probably going to get so banged up on the way home. You're also not maybe sure how to prepare them, potentially. Mm-hmm. They're costly. You're worried that they're going to go bad because it takes you so long to get back to the store in between visits. These are all considerations. So, okay, frozen. It's 120 degrees out with heat index. And you're riding the bus. You've got an hour home. You're going to be outside. It's going to melt. Cans. Ooh, those are heavy. You're pushing a stroller. You're holding a younger child's hand. You're trying to make sure the third child isn't in the street. And you got to get on and off the bus and walk, and heavy. Chips are light. Calorie dense. They're not going to go bad. So these are all things that we start to think about, that does our environment drive our choice and decisions? Mm-hmm. And they absolutely do. And transportation makes a difference. Access makes a difference. Poverty, education, all of these things are related to health disparities. It's not just about health access. If it was, we wouldn't be able to look at England, who has universal health care, and see that they have a wealth health gradient, meaning that the poorer you are, the less education you have, the less transportation access you have, the poorer your health. Mm-hmm. The more wealthy you are, the more education you have, the more transportation access you have, the healthier you are. It's not about access.
It's not about access.
It's about our communities and how they're engineered.
Mm-hmm. Terri, one of the things, though, I know that we're asking we're talking about the fast food places or the convenience stores, rather. And that is, I've noticed that going into convenience stores now, starting to see more fruits and so forth towards the front of the store.
Right.
Making those kinds of changes also. Is that a product of working with the owners, bringing that to their attention?
No, I don't think so. Okay. I mean, very frankly, I don't think that has been an emphasis, that at least that I'm aware of. Mm-hmm. And I've noticed some of that. I think we've got a long way to go. Mm-hmm. Certainly the variety of fruits pales compared to the variety of chips at most of our convenience stores.
That's true.
I think we're still struggling with that, but we'll keep trying.
We'll just keep trying. Dawn joins us from Chesapeake. Hi, Dawn. You're on the air.
Yes. I appreciate so much your conversations today, and want to get on board to do everything that I can to help. I think the examples that we have and the knowledge. The Virginia Tech had an extension service with the agriculture department, and they used to have recipes for making good foods with ingredients that were healthier and handy to keep on hand. And I think people used to walk, and I think some neighborhoods didn't want walks through their neighborhood sidewalks because it would encourage people to come through. So the mom with the stroller, the bike availability, North Carolina's way ahead of us. So I embrace all of these, and we can't say that it's more expensive cheaper. It's just the choice. Those chips are more expensive than something else, and those frozen things are right. Thanks for your program. My doctor, picture's been on my refrigerator. Good example, and I don't open that refrigerator to get junk. When I look in there, I look at her eyes first, and the picture ran in the paper. And I hear her laugh.
Dawn, thanks so much. I think she's talking about you.
I'm a lot of people's conscience, I think.
But if that's what it takes, that's great.
That's okay. I'm okay with that.
Exactly. Everybody in Norfolk.
See what that picture looks like, though.
440-2665 or 1-800-940-2240. What changes would you like to see in your neighborhood to help make all of Norfolk, all of Hampton Roads for that matter, a better, more safe, more healthy place to live? Give us a call and join our conversation. 440-2665 or 1-800-940-2240. Dr. Whibley, Dominique talked about the rec centers and the fact that the hours are going to be changing and so forth. What does that mean for children? Let's talk about the childhood obesity issue for a little bit.
Well, it means that when that child comes home and there's the choice of, do I stay inside and play or watch TV or whatever, or what's naturally available to me in my environment that I could go outside and safely play with other kids in the neighborhood, and will it close before sundown, or will it close, right at sundown? How would that, limit their choices? If there were other things on the way to the rec center that the family could do, it's all those things. It sounds like we keep saying it over again, like we don't have anything else to say, but it really comes down to the global environment that's in place that really makes it easier for the family to have a choice. And we talked about that at the Obesity Summit in Portsmouth in the fall. And the young people told us, not public health experts.
So what are the young people saying?
The young people said, I'm afraid sometimes to go in the street and ride my bike, because when that bus comes down the street, it comes fast and it hits that corner and turns, and I don't know if they're going to see me. The other young people say, I get to the park, I can have fun, I'm allowed to go, but once I get there, people don't act nicely. They are fighting or fussing at each other. The one young lady said, I want to be able to go to the park, I want it to be safe, and I want people to see us having a good time, but I don't want them looking at me the wrong way, because I don't like the way they look at me.
Wow.
And this is from the mouths of babes. And so they're saying, if you put it, we'll go. It would be nice for the schools. If the rec centers aren't able to stay open, can the schools, but the young people said, if the school was open at a different time, after school was out, I might go.
Is that something?
Terri? That's one thing that I've been very excited about, is that I think we've all noticed that we have these wonderful facilities at our public schools, and they are the community schools. And we now have started a program that, in alliance with our school system, that will now be opening up the school grounds at non-school hours, obviously when athletic programs are not being utilized. For instance, we're starting over at Norview High School to use the track there, and so that citizens can come out and use that track to walk. And it just makes so much sense. I mean, we could expand this into the gymnasiums, which we've started trying to do, and it's really a win-win situation that all of those facilities should be used as much as possible.
That's fantastic. I live near Norview, so that's good. Gary joins us from Norfolk. Hi, Gary. You're on the air.
How you doing? I'm calling. Some of the roads, even when the city's worked on them, they haven't made them traffic safe or pedestrian safe. Good examples up by the new CVS pharmacy, and you live near, you probably know it, there at Little Creek in Chesapeake. There's a car wash right down from there. There's a 3-foot ditch you have to get over if you don't want to walk out into traffic. And the city, when they came in and redid some of that area, they never even thought to put a culvert in there and a small walkway across so people don't have to walk out into the street. I live close enough to the CVS and that. I'd walk up to it, but I don't because I don't want to walk in the middle of 2 lanes worth of traffic, especially early morning.
Okay, let's get a response from our panel. Thanks so much for calling, Gary. Go ahead.
Yeah, I'm actually
Amy.
not familiar with that specific location. I have to drive over there and take a look at it. But in working with multiple cities on these issues, often it's not that they didn't think about it or didn't plan for it. A lot of it also has to do with the right-of-way, how expensive it is to purchase the right-of-way. Some of it also depends on the city's policy about road work and how they replace things. And I'm sure as it changed in Portsmouth, hopefully it will be changing in Norfolk as well to implement complete streets policies.
When you all were in Portsmouth, when they did something called a walkability tour, am I correct in that, where you all actually got out and walked around and kind of documented some things? Is that right?
Yeah, we actually walked and drove around.
Okay.
And actually we partnered with WHRO on that. And actually there's a great video if people go to Blueprint America. I think there's actually a link on the Healthy Portsmouth website, healthyportsmouthva.org as well. But we took a walkability tour, and it included both walking and riding around the city. And so we basically loaded up our leadership team for Healthy Portsmouth, which included a lot of highly placed decision makers in Portsmouth, along with the transportation director, one of the police chiefs, and we drove around the city. We got out and walked different places. And when you start looking for walkability issues like the gentleman was just talking about, you start seeing those things. You look at the city with a new set of eyes, and all of a sudden, we were going, wow, now when I drive around the city, all I see are goat trails. And goat trails are basically those little paths that people wear on the side of the road. If there's a path, i.e. a goat trail, that tells you people are walking there, and that tells you that ideally a sidewalk would be well placed there. But also issues like this ditch, which I would suggest that, we look at going out there and taking a look with the city to see what can be done about that the gentleman talked about.
Absolutely.
So has this walkability tour been done in Norfolk?
Yes,
Okay.
and we need to do more of it. But it's really like we talked about last night when we were talking about this bike commission. It's a matter of, for instance, we had recently restriped a street, and that would have been an opportunity for us to say, wait a minute, before we restripe this, let's put in a bike lane. So it's a issue of kind of changing that whole mindset. And so it's throughout a city, not just a few people that are saying, let's make this city more healthy, and everybody else goes back as business as usual.
Right.
So, it's a continuing effort, but walkability, that's, I didn't even know that was a word, several years ago. Now we have walkability, bikeability. It's fascinating. You can actually go online on some real estate rental sites, and if you're looking at a place, they'll show you what the walkability is to the closest grocery store, to the closest shopping. It's a growing movement that's long overdue. And
you think that with the increase in the amount of condos and apartments and so forth downtown, that also was brought, that process was thought about as those were coming up?
It absolutely was. And there's another aspect that we haven't talked about also, is to include the disabled. And this is a huge area that we have to constantly remind ourselves to make sure that when we do try to look at the accessibility, that we make sure that it's also accessible for the disabled. So that's just another aspect of this healthy initiative.
Okay, we've got about 2 minutes left. I want to ask each one of you, what would you tell citizens today, one from a personal perspective and then also from a collective, in terms of what we need to do to continue to make our city healthy? Dominique, let me start with you.
I think from a collective perspective is make sure that you're registered to vote. Make sure that when you register, you use that right and you vote. And you vote for the people that speak on your behalf to help facilitate the health that you want. And I'll leave it at that. And so on an individual level, I would say sometimes people overcomplicate health. that it doesn't have to be a million, life-altering, earth-shattering changes. It's one simple change. And even in the city of Norfolk, if you say, I'm going to ride the tide X amount of days a week, the act of doing that has now added X amount of steps to your day that you wouldn't have had if you had driven your car and parked right next to the door of your destination. The very act of getting to the station makes simple changes, and the fact that if you choose public transportation in some instances, it's less expensive to do that than it is to continue to drive your car, not to mention the relief of stress, the free time, quote unquote, that you would have. So keep it simple.
Okay. Amy, you got 30 seconds.
Sure. I would say for individuals, understand that it doesn't have to be a gym membership, that you can incorporate activity into your normal daily activities by doing some things that Dominique said, by moving around more, by making simple choices. From a population level, from a community level, I think we need to start having big conversations about communicating with our leaders about what we want. If we want complete streets in Norfolk, we need to talk with our leaders about passing complete streets policies, and those types of things.
Okay. And our leader, Dr. Terri Whibley.
I've heard all these things. I mean, this has just been a great summary. And I think one thing that's really important for us to keep in mind is to remember the fun factor. And this is about families. This is about neighborhoods and communities. And this is about having fun together. And when we do that, I think we all become healthier.
Okay. And ladies, we're out of time, but I thank you so much for joining me today. And that is Dr. Terri Whibley, Dr. Dominique Williams, and Ms. Amy Paulson. Thanks so much, and we'll be right back. And welcome back. The mother-daughter relationship can be one of the most powerful relationships on earth. And with Mother's Day a little over a week away, we thought this would be a good time to talk about our moms, be they biological or surrogate, and the impact that they've had on our lives. Our Lisa Godley recently sat down with 3 generations of women who were more than happy to celebrate the bonds they share as mother and daughter.
For Flora and Thursa Crittenden, spending time together isn't just something they do, it's something they really enjoy. Thursa describes her mom this way.
We have a very special relationship. My mother truly is my best friend. She's the one that I confide in, I cry with, I laugh with, we debate, we do all of those kinds of things. But we definitely have a strong bond.
And as you've probably guessed, the feeling is mutual. Flora has 3 children. Thursa is her only daughter.
Our talks about the family, about situations we have to face, about solving problems, we're just extremely close. And I feel that closeness and that love that we have for each other is the most important thing to me. We do a lot of things together, but I think that is what makes me feel so good about having a daughter like Thursa.
Flora, who is now in her late 80s, was not raised by her mother, but by her 5 aunts.
They were very loving. They served as great role models, and all of them gave back to society.
It was their influence that took Flora from educator to public servant. She served in the House of Delegates for 11 years.
I can say that I have been very, very, very blessed. I have a terrific mother, and I'm glad that she has shared herself with the rest of humanity. She's taught me that the best way in life is to share and to be thoughtful and to be kind and considerate and to be independent. I've always liked that about my mother. Very independent, very strong-willed, and generally her strong will is for the common good. And so she's just a wonderful role model. I'm just very, very fortunate to have her as my mother and my best friend.
Like mother, like daughter.
I can't tell you all of the things that she does with the community. She works on voter education projects. She works to help young people understand what they need to do to grow up to be productive people. She just works everywhere. I tell her all the time I'm sorry that I begged her to retire because she's busier now than she was when she was working.
In a world where everyone seems so busy, 24-year-old Rachel Smith realizes the importance of staying connected. That was especially true when she moved from the Norfolk area to Washington, D.C.
When I first moved here, I was so homesick, I called my mom sometimes more than once a day, and she was never annoyed. She would be like, "It's okay, Rachel, I don't mind talking to you," and we'd have like a 5-10 minute chat. But my mom's often one of the first people I call when something new is going on in my life. The time you spend is just really important. Just 5-minute phone calls can make a difference in your relationship.
Rachel was also eager to share one of the most beloved treasures of the mother-daughter bond, memories.
When the song Hey Ya came out by Outkast, we put it on the stereo and turned it really loud and just danced around the house to it. That was one of my favorite things that we did when I was younger.
We asked Flora, who's been a mom for more than 6 decades, to leave us with her thoughts on motherhood and the mother-daughter bond.
I think being a mother is the most important and most difficult job in our society because it is a mother's responsibility to love and to nurture and to help young people to become good, kind, productive people. And I think a mother and daughter have a very special and unique relationship. Boys are wonderful, and mothers have to work hard with them too. But I think because we tend to like the same things, we tend to want to do the same things, and we want to chat about the same things. So that brings us very close together and gives us a very unique relationship.
For Another View, I'm Lisa Godley.
And if you'd like to do something special with your mom or daughter, plan to attend the Mother-Daughter Tea and Conference on Saturday, June 9th from 9 until 2 at Ivy Baptist Church in Newport News. It's sponsored by the Urban League Guild of Hampton Roads. Yours truly will serve as MC, and the keynote speaker is Pastor Hope D. Blackwell. There will be activities and workshops for moms and daughters of all ages. For more information, go to our website, anotherviewradio.org. And now time for some other things to view and do in Hampton Roads.
You will be my Saturday love.
You're invited to attend the Primrose School at Cahoon Commons Spring Fling tomorrow, Saturday, May 5th from 11 until 2. Carnival games, face painting, horseback and pony rides, and much more in store. The school is located on Grassfield Parkway in Chesapeake. Call 842-6589 for more information. The Norfolk FBI is holding a parent awareness seminar on Tuesday, May 8th at Paul DeCamp Community College in Franklin. Parents will learn about innocent images, sexting, cyberbullying, and gangs. Call 455-3161 to find out more. The Quality of Life Corporation will hold a Train the Trainer seminar for drug and alcohol addiction recovery. It's Saturday, May 12th at the C&L Services Corporation on Queen Street in Portsmouth. The seminar runs from 9 until noon. Call 398-0058 to register. And the 4th Annual Hope Empowerment Conference and Pearls Luncheon will be held on Saturday, May 12th, starting at 8:30 in the Chesapeake Conference Center on Woodlake Drive in Chesapeake. The conference focuses on single mothers, and it's free, but you must pre-register. Call 356-5321 to find out more. These events and more are on our website, anotherviewradio.org. And before we leave you this afternoon, a very special congratulations to 3 outstanding Norfolk students who are among the 1,000 class of 2012 Gates Millennium Scholars. They are Micah Lamel, Booker T. Washington High School, Lake Stovall, Maury High School, and Dreama Vanador Johnson from Norview High School. As a Gates Millennium Scholar, these students have their entire 4-year college education paid for. Job well done. And that's our program for today. Next week, the Roundtable takes on the issue of talking about race. It should be a lively discussion. For producer Lisa Godley, audio engineer Perry Smith, and Danny Epperson, who answered our phones, I'm Barbara Ham Lee. We'll see you next Friday at noon for Another View.